Well, we gotta live up to last year.
Okay, it's getting really quiet. Everybody ready to start?
Yes.
Okay. Well, welcome everyone. It's so nice to see everybody here for the large local grant presentations. I'd like to start this evening with a remembrance and a few thank yous. So we've already talked about Lynn Lindsay amongst a few of us already, and we do have her celebration of life tomorrow here back at the Rainier Club. Lynn had a very long history with the Seattle Rotary Service Foundation. She was a longtime member of Finance and Investment Committee, which is surely one of the reasons why we have some funds to go with this grant tonight. She also loved to plan parties, and she did all of the planning for our party this last year when we were here for the large grant prior in February. She did the menu, so the menu should look familiar to some of you, including the deviled eggs, which Sarah and I made sure we had again tonight. We miss her a lot. She's leaving really big shoes to fill, and we know that a lot of people at the Rainier Club also miss her. As for thank yous, I'd like to start with the 10 scoring team members. These are the people that evaluated the grants and assisted in determining the top 3 finalists. And we especially want to call out some of our newer Rotarians, Maddie Vonhoff, Ford Van Winkle, and Cindy Sherrick. These 3 helped us determine the finalist along with Burr Stewart. I know he's here in the audience, providing his really seasoned voice along with Jeff Pritchard and several other board members. Sarah Weaver, our immediate past president, she handled all the food and drink tonight, along with Krista Cook from the Rainier Club, and Lillian Sherman, who is going to be president in July 1.
Good.
She created these wonderful sheets that you're all holding, which really talks about the mission and the purpose of the finalists tonight. Outlines everything so you can read along as the finalists are presenting. And of course, Mary Goldie, who keeps us on track. Thank you, Mary. Lori Walker also deserves a very special thank you. She's the chair of our grants committee. And she and they not only overhauled our application, she made significant changes to the grant criteria and the weightings. One of the key objectives this year of your Rotary Service Foundation is transparency. It's been a very important theme for us for the foundation this year. And we made sure that all of the applicants were aware of how their proposals were being judged. Now, our process this year was a little bit different. Lori Walker, Lillian Sherman, and I met with Seattle community leaders, and we wanted to ask 2 questions. So first, public safety, the vitality of downtown, and the drug crisis. Are these still important issues that need to be addressed? Second, would $75,000 make a difference to the organizations doing this work? In the end, we received 14 very solid applications, and we had a clear top 7 after the initial scoring. From there, Lillian walked us through a very effective process to identify the top 3. I'm very proud of our club. We've been so willing to jump into the deep end and address these very challenging issues that face our city. Finally, I want to actually give some context for what we're about to hear. In 2024, over 16,000 individuals were counted as experiencing homelessness in King County on a single night. The majority of those individuals, about 14,000, were located in Seattle, King County area. This places Seattle as the 3rd largest homeless population among US cities, just behind New York City and Los Angeles. It's a complicated situation, and fentanyl had a lot to do with it. What I love about our finalists is that these 3 organizations are directly tackling the vitality and the safety of downtown, from 3rd Avenue, Pike and Pine, to Little Saigon in the International District. Their work benefits businesses, residents, and the general public. And some of the people doing the work have been fed, trained, and sheltered by the same organizations. They make the city safer for everyone, and they offer help for those on the street who are willing to be helped. Tonight, you'll hear from these organizations about their innovative approaches to tackling these critical issues. After the presentation starting tomorrow, club members will have the opportunity to vote for their preferred initiative. Tonight's event will really show you what giving does and the difference that it makes. This is the through line of what your giving allows us to do. By being here, you're going to be able to see firsthand where your money goes. I looked at the list of those who are in attendance tonight, and so many of you have already generously donated to the foundation, and we really, truly thank you for that. If you've forgotten to pledge, please feel free. We've got Sue McNabb and Nancy Cahill tonight with pledge forms. And then I also know that there are other people like myself. I am a January donor, so I know some folks continue to donate throughout the rest of the Rotary year, so we thank you for that. Okay, now I am going to turn it over to Operation Night Watch. Deacon Frank is going to be first up, and then we have Michelle Aguilar Ramirez, and Anita Hall. Yes, so
Great.
Please come on up.
Great.
Thank you.
Great. Thank you, Vicki. Thank you, Sarah. Thank you, Jen. Thank you, Mary. Thank you, Seattle Rotarians, for your great concern about the vitality of our city and the great relevance of things like public safety and the drug crisis, which we're confronted with every day. Thank you to our colleagues from Uplift Northwest and from We Deliver Care and from Purpose Dignity Action and Third Avenue Project and for REACH. It's truly a privilege to be in this most important work with you all. My name is Deacon Frank DiGirolamo. I'm the Executive Director of Operation Night Watch. I've also been a volunteer nighttime street chaplain with Night Watch for 13 years. And I'm going to take the first question and I'll hand it off to my colleagues. How would you spend a possible grant from Rotary? In short, Operation Night Watch would invest it in our growing continuum of services helping those most in need. And I'll paint a picture of our continuum of care with you. Since 1967, we've been practicing non-judgmental street chaplaincy, just befriending people. And we especially find people who are most lost, suffering from things like rejection and homelessness, a family breakdown, resulting in addictions and the tragedies of human trafficking. And we do that to build trust over time. From there, the continuum moves on to welcome people into a nightly hot meal, lovingly prepared and served by volunteers every night of the year. And we serve 150 meals every night. We've seen more than 1,200 unduplicated individuals come in for meals already just this year. And it's a great opportunity to learn stories and write our shared story with people. From there, we run emergency shelters within loving communities, and we do that to help people reintegrate into society. We have one shelter for men and one for women. We offer 40 beds per night. We will provide shelter like this for over 200 unduplicated people per year. We think this is a mustard seed that can grow greatly around the city. And we will offer 14,000 bed nights to those folks through the course of a year. Once someone is in a shelter, especially, we offer case management to help them further reintegrate into society. We've recently launched an Operation Night Watch free medical clinic. We're able to provide malpractice insurance to providers who'd like to partner with us. And we run 24 units of permanent housing for formerly homeless senior citizens, a fast-growing part of the population. We're especially excited about our growth in a few key areas. Our emergency shelter for women just launched last year, fledgling, but we already have 1,000 bed nights, and the ladies say it's the best thing ever. Our case management, we've recently doubled our number of hours, and our medical clinic just launched 2 months ago. Our mission in Operation Night Watch is to reduce the impact of poverty and homelessness in keeping with Jesus's teaching to love our neighbor, and we see everybody as our neighbor, and we strive to just find the person most in need at a given time. And as your focus area acknowledges, those needs are growing and they're big. The drug crisis. We recognize the link between addictions and traumas. Science is increasingly showing us that addictions are developed around efforts to self-medicate the pain of trauma that frequently stems from childhood experiences. The drug crisis seems to be a symptom of something much greater that needs healing. As our friend from the streets, Haley, recently revealed to us as she sat on the sidewalk on 3rd Avenue and was injecting something into her arm, she looked up and said, "Can you help me find the piece I'm really looking for? I know it's not in the syringe." Public safety. We acknowledge that not only are the working and housed public experiencing dangers of theft and assault, but large numbers of our kin are incredibly vulnerable while under the influence of their self-medicating and their general unhoused status. So much violence happens unreported within the unhoused community. Public safety is truly a shared concern for everyone. And vitality. We acknowledge that not only is economic vitality in jeopardy, but our brothers and sisters are literally dying on the streets. I recently preached at the annual memorial for the 359 who died on the streets last year. At Operation Night Watch, we will continue to light memorial candles as needed, but we would much rather do everything we can now to revive and reignite lives one at a time through our continuum of care for those most in need. Thank you for your consideration. I'm going to turn it over to Anita.
My name's Anita Chakravarty-Hale, and I just want to thank all of you for being here tonight. It's a great opportunity. Thank you for listening. So Frank gave you kind of a broad overview of our services, and I'm going to fill in some of the details. And I'll start by saying I've been doing nonprofit work for about 25 years. Legal aid work, youth violence prevention work, and now work at Night Watch. And what I really love about Night Watch is the fact that we just meet people where they're at. Very low barrier services. Anybody can come just as they are, which is really important to me. So he talked a little bit about our shelter dispatch. 150 meals are served every night. That's about 60,000 meals a year. And we're one of the last places open for people. So on a cold night, it's nice for people to come in, feel invited, learn about resources, pick up things that they might be needing, extra water, a blanket. It's just a safe place to be with others. And then we have senior housing, which has about 30 individuals per year go through that program, 24 units. This is for folks, some of whom have been homeless for 20 years, living on the streets. But what's different about our program is that our housing coordinator knows each individual by name, very low turnover rate of people who are living in our senior housing. And it's, once again, they can live in community with other people and they're able to get resources they need and live with dignity. And then our street ministry program is another program where we have 10,000 interactions a year with people who are on the streets in encampments. Once again, water, sandwiches, blankets, getting to know people and helping people get to their next steps. We might see people once, and I'll share a story. We might know people for 10 years, 20 years. Recently, I was contacted by somebody who wanted to make a donation, and they were a client over 20 years ago and changed the way that things were going for them, still in touch with some of our street ministers today, and just wanted to give back to programs. And it just really warmed my heart. But that's kind of Night Watch. The full gamut of human need is kind of what we're reaching out to. So one of the questions was about how we're supported. About 60% of our dollars in support come from individuals, about 25% from grants, and the rest is from businesses and churches. We work with many different organizations in the city, Providence, Salvation Army, Recovery Cafe, lots of different places. And because we work with people as individuals, we are willing to kind of make referrals anywhere as they are needed. How will this project be sustained over time? Just a patchwork of funding is what we're looking for. We don't want to be too dependent on any one type of funding. So talking to people, building relationships with donors, that's kind of the direction that we go. And Michelle Aguilar Ramirez is going to talk a little bit about volunteer opportunities.
Okay. Hi, everyone. My name is Michelle Aguilar Ramirez. I am the volunteer coordinator here at Operation Night Watch. I am going to go based off of this sheet right here. I did leave a couple sheets in the front on the table where you guys got your name tags as well as my business card. My job at Volunteer Operation Night Watch is to make it as easy as possible for people to come and give back to the community. So in whatever way that you can support, it could be making cookies, it could be coming in and making a dinner, it could be part of your churches, schools. We do all sorts of stuff to give back to the community. And in general, we just love to have volunteers come in and give whatever time that they can for us. Like I mentioned before, we have our food and our shelter opportunities. We have our housing opportunities as well, volunteering, and we have our street ministry. We are faith-based, but we do not enforce our faith-based. Anyone is welcome to volunteer with us, and we support anyone, and we meet everyone where they're at. And thank you so much for this opportunity.
Thank you, Operation Night Watch. Okay, next we have Uplift Northwest, Shama Shams and Max Cherazen. If you would like to come up, please.
Sorry, I have to do that too. So thank you to the Rotary. It's such an honor to be selected in one of the top 3. Just being here is truly an honor. So thank you. I am the Chief Impact Officer for Uplift Northwest, which is a very nice title, and I do love my title. But I wanted to share a little bit about our history first. Back in 1921, Martin Johansson was looking outside his window and he saw people standing in line for the soup kitchen. And there was some fight and commotion breaking out. And he said to himself, there's got to be a better solution. And from that, thought, the Millionaires Club charity was formed. And I'm sure some of you have heard of that. And in 2020, we rebranded and became Uplift Northwest. But our mission is the same. And what Martin thought of, that still resonates with us. There has to be a better solution. And what is that we do? What is our solution? Well, almost everyone that comes into our facility are looking for a job. They are looking for a path for economic stability. So we meet them where they are by asking, one of the basic things we ask is, what do you want to do? What do you want to be? And once we know that, we don't have like a set, here's your, steps you have to take. We try to like really customize to the individual's need. And so a lot of our individuals have, homelessness issues, or they're dealing with addiction. So we partner with a lot of other support services agencies to kind of give a holistic approach to that individual. And then we have our training program, which Max is going to talk about in much detail, which is our RISE. We launched it last year, and it stands for Roadmap to Independence and Sustained Employment. I got it. And then we have a unique model, which is our social enterprise model, employment social enterprise. What we do is we work with private companies, even with the city, like from graffiti removal to litter abatement. We train our participants to go out and work in our community. What creates a sense of community when you're out there cleaning and you're actually giving back to your own neighborhoods? And studies have shown over and over again that there is a direct correlation between poverty and crime. And so when you invest in workforce development training, you are essentially giving people a way out and away from committing crimes. And but that's what we do today. And like I said, we've been around since 1921. And the reason we're still here is because Uplift knows how to be innovative and how to change with the time. And so even though our mission is the same, our delivery model has been updated, and it probably will change multiple times, way past my lifetime, to meet the future needs. And so one of the things is I put some invitations out there. We're having an open house next Friday, and it's a graduation of one of our cohorts. I would love for you to come and see our headquarters and our training facility in Belltown, where we've been since 1940s. And we love our location. We're in the heart of Belltown, but the facility we're in, we've been there since 1940s, and it needs major updating. And we want to create an environment, create a place where we can, provide a lot more cohorts. We can train a lot more people. We want to bring in, groups of volunteers to come in to do mock interviews, to help with resumes. We want to reach out to more people. Right now, about 20% of those we serve find permanent or long-term employment. Just imagine if we could expand the number of people we can reach, what impact that would have in our community. In 2024, we gave $3.5 million in wages. So just keep multiplying that of what the possibilities are. And with your support, I think that, it's more than just your monetary giving. It's also the validation that you believe in the work that we're doing and the work that we will continue to do for centuries to come. I'm going to let Max talk a little bit on the detail of our grant proposal.
Well, thank you, Shama, and thank you everyone for inviting us to be here and getting this opportunity to speak. So as Shama said, Micah.
There you go.
Can everyone hear me okay right now? Thank you. As Shama said, I'll talk a little bit more about what we could do with your support. Like first and foremost, with your help, it would allow us to make sure that in the first full year of our new training program, we would be able to show the community the impact that it makes. As Shama mentioned, we've been around for over 100 years. Last year, we saw over 800 people come into our building to either apply for work or to do some kind of training. And yet we made a bold decision that we were going to change our service delivery model because ultimately our goal is to make sure that everyone who comes through our door, by the time they leave, they are employment ready. That is the primary goal of Uplift Northwest. So we created what we call our RISE program. We piloted it last year and we're in the midst of our second cohort. It's a 4-week training program where folks learn essential workplace skills. They learn about growth mindset, emotional intelligence, things that you would want to see in any workplace. But along the way, they get help with how to do their resume. They'll do some mock interviews, and they do this with the support of their peers as well. To ensure that they get through the entire cohort. They have case managers, they have housing assistants, they have people who are able to provide them with transportation assistance for clothing to ensure their success within that program. So with your support, it would allow us to sponsor at least one and possibly even 2 cohorts. Additionally, one of the things that we want to do is get a vehicle and supplies for our employment social enterprise. These are people who are going across the city of Seattle doing litter abatement or graffiti removal, overall doing what they can to make the city beautiful and vibrant. Additionally, we try to make Uplift Northwest a community hub. So we're really proud of the relationships that we've built, whether that's with Plymouth Housing, getting people into housing, the Prison Scholar Fund, who we have brought into our building for digital literacy training. And we'd like to continue doing this, having people come not only to our building when we host job and resource fairs, but also being able to refer people when necessary. Just to give you an idea of the impact of what is it that we do, I want to talk about one participant that I met a couple of years ago. So we are a second chance employer. We have people from a lot of different backgrounds who come to us, but we also value the safety of our staff, our workers, and our employer partners as well. So there was one person whose background was pretty serious. To the extent that before I felt comfortable hiring her, I had her have a discussion with me first. And I allowed her to just kind of explain her situation. And she didn't want to talk too much about it. But one of the things she did say was that drugs played a big role in it. And that she was really looking forward to getting another opportunity, moving past what had happened and getting a fresh start. So with that, we did make a decision to allow her into our program. She got her flagging certification. She took a class on stress management. We ultimately put her on one of our litter abatement crew. And in those past 2 years, she has been an exemplar of what it means to be a worker. She hasn't gotten into any trouble. She shows up to work 40 hours a week, and she just does excellent work. And if we're able to do this with one person, your support will allow us to do this with even more. I'll turn it over to Shama for some closing words.
So I just wanted to close by saying that Uplift, I think, one of the things we always ask our board members and ourselves, why do we do this? What's our why? And frankly, I will share my personal why is that I'm a daughter of an immigrant who really struggled to find employment and my father had the opportunity, like what Uplift provides, his life on this earth would have been very different. The people that come into our building aren't because they're lazy, they don't want to work. They need second chance, and that is what we give, and that is what we will continue to give. And I hope that beyond just listening to us today, that you come visit us and kind of envision the future with us, because like Max said, that we are looking at being a community hub. What we would love to do in our new facility is invite civic groups, other nonprofits, and even companies that need workers, and understanding what is the demand in the workforce and how can we better train our participants to meet those needs. So we had a great past, but I have a really wonderful feeling about our future, and we thank you for this opportunity.
Thank you, Uplift Northwest. Okay, now we have Purpose, Dignity, Action, Third Avenue Project, We Deliver Care, Simone Wolcott, Tabitha Davis, and Phoebe Fikadu. So welcome.
Hi, everyone. My name is Simone Walcott, and I'm the project manager for LEAD in the West Precinct, as well as the Third Avenue project. The Upper Third Avenue, otherwise known as the Blade, has faced public health and safety issues for decades. Addressing these challenges effectively requires a holistic and place-based and person-centered approach. The Third Avenue project is a partnership between the city's Human Services Department, We Deliver Care, LEAD case management services that are provided by POCAN, Ideal Option, as well as REACH. And then we also have Purpose, Dignity, Action, who does the project management and data. Each partner brings unique contributions to this collective effort. And I would be remiss not to acknowledge the Seattle Rotary Foundation, as well as the DSA Mid-Team, Uplift Northwest, Operation Night Watch, We Heart Seattle, and the Downtown Community Council in supporting the city's efforts. With many people congregating downtown, We Deliver Care helps manage the space by focusing on community dynamics. Their constant presence makes them an ideal partner for LEAD, which provides long-term intensive case management. Intensive case management for individuals facing challenges rooted in extreme poverty and/or unaddressed behavioral health issues. And so I'll hand it over to Tab to explain more about WDC's role.
Awesome. Hey, everybody. We Deliver Care is proud to be a collaborative partner underneath the Third Avenue Project umbrella
This level of expert, dynamic, and strategic focus from each partner is what's needed to address the crisis created at the intersection of homelessness, poverty, and criminal activity. The role that WDC plays in this ecosystem of support is multifold, and I'm going to do my best to summarize those activities into two categories: presence and partnership. Regarding our presence, our staff provides a consistent presence on 3rd Avenue between Stewart and University, and we will be extending to the CID and Little Saigon soon. Yay! But we're outside from 6 a.m. until 9:30 p.m. And these hours are important because crisis is not 9 to 5, and it doesn't take a break on the weekends. Our focus during those hours is to direct vulnerable people to organizations prepared to provide support and services. And we do this by building relationships. That is our superpower. Getting to know folks and their stories, which helps us to make effective and meaningful referrals to these agencies. We connect with over 300 people a month on average, and we also support their needs, their more immediate needs, by providing items like food and water and clothing, and sometimes transportation if needed. We also support the community by providing nonviolent de-escalation, critical incident response and stabilization, and administering naloxone and CPR as needed. For local businesses and residents, we provide a non-emergency response to public safety concerns via a phone number where they can reach us directly. For example, a local company, Gelatiamo, Gelatiamo, they had reached out to us. They gave us a call. We responded and showed up in about 2 minutes. There was a gentleman inside of the ice cream shop, and that was throwing furniture around and being extremely disruptive. We knew the individual was able to get that person to settle down and to leave the store. And we did stick around just to make sure that everything was okay and checked in with the staff as well. Each of these interactions is documented in our electronic database, which allows us to share information with our strategic partners and deepen the collaboration between our organizations. And then regarding partnership, the safety work that we're committed to doing cannot be done without partners, one of which that you'll hear from next. The organizations we partner with and refer people to provide intensive case management, lawful employment, transitional shelter, family reunification, legal support, and so much more. And now I'll hand it off to Phoebe.
Good evening, and thank you for the opportunity to speak with you today. My name is Phoebe Picadu. I am the REACH Housing Director at Evergreen Treatment Services REACH. For 30 years, REACH has provided outreach and support to individuals with high needs, connecting them to shelter, healthcare, treatment, and permanent housing. I want to introduce you to Matthew. Matthew is a 40-year-old man who spent the last decade homeless, struggling with mental health and substance use disorder. His story is not just about addiction or homelessness. It's about trauma, loss, and resilience. After his divorce, he took all of the marital debt, which wrecked his credit and left him unable to secure housing. The weight of his circumstances pushed him deeper into alcoholism, and ultimately, he lost custody of his children. But last winter, Matthew came to TAP. At first, he wasn't ready to engage in housing services, but our lead care managers built trust at his pace. By spring of 2024, he moved into stable housing, and today, he's not only have a roof over his head, but he's also reconnected with his daughter, talking often about her progress in college. Then there's Ken, who spent over 30 years homeless on 3rd Avenue after aging out of the foster care system. Without support, he lost his first apartment and remained in the only place he knew. He had no faith in housing until he saw others from the 3rd Avenue successfully move into homes through TAP. That belief led him to our program, and now, for the first time in decades, Ken has a place to call home. He's not alone. Through the TAP project, in a short period of time, we placed 37 individuals into permanent housing and 23 other individuals into co-lead lodging. But housing alone isn't enough. Our collaboration ensures that clients also have access to reach drop-in spaces for support, on-site nursing care, and direct referrals to our mobile substance use disorder treatment van in downtown Seattle. The work we do is not just about getting people into housing. It's about breaking cycles, restoring dignity, and creating long-term solutions. Lead case management is evidence-based and person-centered, addressing deep unmet needs while reducing public safety impacts. Housing navigation is incredibly challenging, with regional housing waitlists stretching months or even years. Our partnerships have allowed us to cut through red tape and successfully place individuals who otherwise would have remained lost in the system. There aren't just numbers, they are lives, families, and futures. When we house someone, we aren't just providing shelter, we're offering stability, healing, and a second chance. We ask for your support, not just to fund a program, but to invest in people. When we provide housing with the right support, we don't just change individual lives, we strengthen entire communities. Thank you.
So Purpose Dignity Action, PDA's role in all this is to provide the project management for the Third Avenue project. So we work closely with WDC, our partners, and our stakeholders to really steer our strategy and adapt to the changing needs of the neighborhood. We also maintain regular communication with our stakeholders in the neighborhood via phone, email, in-person check-ins, surveys, and I'd like to share with you some feedback that we've gotten from a couple of our stakeholders. An employee at John Fluevlock Shoes, which I recommend shopping there, they said that WDC is an amazing resource. I would not feel safe at work if they did not exist. Their staff is so kind and caring to our staff and the individuals on the street that they help. I can't say enough about how safe they make me feel. Another quote from Kathy Lee, Director of Fossil and Stone, another place you should shop. WDC does indeed deliver care to all. Yes, we are still finding comfort in having WDC present when we open and close. 90% of the time, things are pretty peaceful, but that 10%, when we have some interesting characters out there, we sure do appreciate having our WDC buddies present. These quotes from local businesses highlight the real impact of the work in the community. To continue making progress and address the growing demands, the grant we're discussing today would play a critical role. The Community Impact Grant would support We Deliver Care in managing significant increasing responsibilities as the City of Seattle expands their work downtown. With a 400% increase in service coverage in 2025, and no corresponding funding increase. This grant would help serve as a contingency buffer, so a resiliency buffer. So in instances where payment doesn't happen on time, which as we know, when you're getting public funding, payment's not always consistent, this would help keep WDC afloat to continue providing the care to the community that they are so dedicated to serving. And if awarded this grant, Purpose Dignity Action will give all funds directly to WDC for this purpose, with the understanding that the money will be retained and replenished, not treated as profit. This project is expected to move to the CARE team later this year, and I really encourage you to take a look at our application. There's a lot more information in there, ran out of time, but we are so grateful to be here. We appreciate the opportunity, and we'd love some Rotarians to sub in for WDC during their day off. So if they have some folks interested, you can definitely participate.
Wow.
Thank you. Okay, thank you, finalists. Loved all of those presentations. Now it is time for questions and answers, and I'm going to turn it over to Jen Gladish.
I don't know how.
Oh.
Can I? It's
Yeah.
on. I would love for us to all just take a second to recognize the fact that we are here because we all have stable housing and excess of funds to be able to support things like this. And the work that is being done is incredible. We all know I cry. I'm not going to cry. But I feel like we should be very appreciative of your time because the work that you do makes Seattle safer for all of us, makes it a happier and healthier place for everybody. So I'm proud to be here. I have some ground rules before we get started with questions. And, we're all here because we're kind, caring neighbors, so we're all going to respect these rules, I'm sure of it. So for our panelists, we have a microphone to share. So I expect that you all take an appropriate amount of time and then pass it on to the next organization and to our membership. When asking a question, the same as I did last year, I would love for you to ask a question that is relevant to all of the panelists so that they all have the opportunity to answer and get an equal amount of questions. We do have a different take at the end. You all will have to figure out amongst yourselves, since it's a collaborative group, how that pertains to you. So sorry about that. That's going to be a fun one. So I'm going to start because I always do that too. My first question is, I would love for you to address, there was some mention of it, but what are the barriers of access to receive services at any of your organizations? Starting with you.
There are no barriers.
Wait, no, okay, good.
Yeah, I was just gonna add that honestly, anybody can walk off the street to our dispatch center, and we just ask for a name. We really don't ask any other information. I've worked at other nonprofits where you would have to do a large intake to get services. But you can just get through the door and enter at Night Watch. So there's no long intake process. We do have case management, so people are there to help you once you enter, but primarily because of the way we're funded, we're able to work with everyone.
Thank you.
Yeah, also we have pretty limited barriers ourselves because, for instance, if you want to apply to be part of our program, there is an online application. But if you're not great with computers, you're free to come to our building, and we have people who are able to help you out with that as well. If there's any additional support that you need, we have a staff of people who are willing to help you, whether it's getting employment documentation or any other issues that you may be having.
So there are a few pathways into our program. The first is through law enforcement. So at the point of arrest, officers can decide to divert the charge to bring people into our program to address, again, that root cause to try to reduce recidivism. The other way is that officers could say, hey, I recognize this person. They haven't done anything illegal necessarily, but I have a feeling they're up to something. They can also refer to lead that way. The other way is community referrals. So in certain areas of the city and our focus impact areas, we can take referrals from community members and service providers. And our target population would be people who are engaged in the criminal legal system, or people who are at risk of being involved in that system. And the root cause of that involvement has to be due to extreme poverty or to behavioral health or substance use. So our goal is to really target the folks that are having the highest impact in the community.
And the only barrier to being able to really access some of these services is that we can't meet all the needs of the city. The need is much higher. And so if we had the capacity, we would love to serve more individuals. That's why we need partners like you and others to really help bringing more resources into the work that we do.
Wonderful, thank you. Keep the microphone down at that end. You'll get it. Oh, do you have something to add? I'm so sorry.
Oh,
Go ahead.
I just wanted to say from a referring perspective, what we have found is that with fentanyl, it is such a cheap and potent drug, and that it calls people back to it every 20 to 30 minutes. And so with a lot of referring agencies that we try to connect with, their screening process or their process to intake someone to get them enrolled, it can be anywhere from 60 to 90 minutes. And so oftentimes we are faced with an individual who is addicted to fentanyl, who wants help, but is afraid of being painfully sick, and they can't sit for the 60 to 90 minutes. And so sometimes a barrier is that agency or organization, if they can tweak the length of time that it takes to work that process out to get someone into the organization, would also be helpful.
Thank you all. Keep it at that end. You guys are going to get to start this time. We have a question from Kathy Williams.
Two questions, actually, for each of you, please. You touched on briefly how volunteers can be involved. How can Rotarians be involved as a group and as individuals? And my second question is, I recognize $75,000 can seem like a lot of money, but with some budgets, it may be a drop in the bucket. How do you see yourself recognizing Seattle Rotary publicly? Thank you.
We're gonna try to do these rapid fire too, because we don't have too much time and I really want to get through as many questions as I can. Go for it.
All right, so you all can get involved by one, we can give you presentations about like the work we're doing as well as the outcomes. We can also give you regular updates about our project needs, our progress, and any relevant policy changes. And then, like I mentioned, WDC, there's one day a year where they don't work because they have like an all-staff retreat. And so we get coverage from our partners, but we'd love to have some Rotarians out there as well who are able to join us and help provide intervention. And then in terms of the drop in the bucket, I mean, that's a great point. And so that's why as PDA, we want to help support smaller organizations so that that way they can maintain the same level of quality service despite funding. And then eventually, hopefully, we're able to get supported by larger systems in the city.
Thank you for that question. We definitely welcome volunteers. We need individuals to help our participants with their resumes, to do mock interviews. We also run a free eye clinic and be one of the few in King County, and would love to have volunteers come in as an individual to check people in and, help with that. So there are multiple ways, just like our participants, we don't have set things. We try to accommodate based on their need. We do the same way with our volunteers. We want to accommodate what your needs are that matches with ours. As far as how we would recognize you, we've been around for a long time, so we have a very robust website where we would put up your logo. We do a lot of social media, shout outs, and then we also have a monthly e-newsletter. And if you want to do a check presentation, hey, we'll be here. I'll be here.
Hi everyone again. My name is Michelle. I'm the volunteer coordinator for Operation Night Watch. There is a multitude of ways that you guys can be involved. You can go as little as being a one-person group, your family, or having the whole club pull up. We can figure it out. Our biggest thing that we can do is that you guys can go ahead and volunteer is our nightly dinner service. So with our nightly dinner service, we're serving about 365 days in a year. That's all year round, holidays included. We have groups that come in on a monthly basis to serve 150 people coming in through the doors. We only serve 150 people, but we have about 200 people coming in through those doors just to get services for the evening. We got other opportunities like smaller ones like driving the van for the shelter services. We have support at the shelters themselves, like creating communities or having, like for a women's shelter, we want to create like a girls' night of makeovers or skincare. And then for our men's shelter, we want to create more of a community, maybe watching sports or talking about sports or playing card games. With our housing, we also have befriending seniors. We have our gardening with seniors. We have residential cleaning to support them having their areas tidied up. We also have our street ministry. With our street ministry, we have our chaplaincy. So like I mentioned before, we are faith-based, but we do not enforce our faith base. So you can go out into the streets. You would first have to go through the community dinners, and our community dinners are our smaller base dinners. And we serve about 30 to 40 people in those. And from there, you would, after attending a couple of those dinners, you would go into street ministry, actually going directly into the streets alongside with other people who have had that experience. When you're going out to the street, you would be handing out sandwiches, water bottles, socks, because socks are the foundation of comfort. And then depending the season, depends what other basic essentials we do hand out. So if anyone is interested in volunteering with us, whether that's the Rotary itself, your family, or solo, please reach out to me. My card is in the front, and there's also all these sheets that I left up there for you guys. Thank you.
Thank you. Uplift Northwest is going to be the first to answer. Oh, I'm sorry. I keep doing this to all of you.
No, you're fine.
Go ahead.
Just to answer the other question, so we also have a website and we could recognize you on our website, do shout outs on social media. Definitely thankful for any kind of support.
Thank you. I'm so sorry. I'm probably going to do that again. The next question is going to come from the president of our Rotary Club of Seattle, John Bridge.
Well, Thank you for the presentations. You know, this has absolutely been wonderful, and I want to give a real shout out to Vicki and her crew from Seattle Rotary Service Foundation for doing this. This is really superb. And to have this great turnout tonight, I'm just really feeling great about all of this. But more importantly is to talk about how wonderful your organizations have been to our city. But my question has to do with coordination between government and your organizations and all the other organizations that seem to be doing a lot of the same things in our community. And sometimes we all live in silos and are not able to coordinate amongst ourselves, and we're duplicating things when we could all be working in one focal area. So how is each one of your organizations working with other organizations, particularly like our Downtown Association and our city government, in providing the services that you're talking about?
Yeah, you're up.
All right, well, thank you for that question. So currently what we are doing when it comes to working with governments is we do have contracts with the city of Seattle. For instance, when we talk about our graffiti abatement crew, that is something that we partner with the city, and we are going to be doing that for the foreseeable future as well. And we have some grants through King County, which allow us to provide case management and support services for those who are moving from like encampments, for instance, and who were in encampments and are now in housing. So we do have those relationships with government agencies, but we also continuously work on developing relationships with other people with the area. So we host job and resource fairs, for instance, where we invite both employers and support services to come into our building and to share what resources they may have that you may not have. We also invite people to table within our learning center too. So our learning center has a bunch of computers where our participants are able to do work-related activity. And in times of high traffic, we may bring partners in just so they can, any participant who's around may stop by, whether that's healthcare, whether that's access to phones, and so on. And we're always constantly looking not only to connect, but to learn from other organizations as well. As Michelle and I mentioned during our presentation, we are in the middle of redesigning and our service delivery model and what we've been doing for over 100 years. So in doing so, we're reaching out to community partners, seeing how they can help our program, how are we able to help out them. And for instance, like Simone, we've actually met a couple of times, we've talked over Teams. This is the first time I'm getting to meet her in person, but just continuously working to get to know other organizations and seeing what are ways we can help each other that's mutually beneficial for the folks that we serve.
Rock, paper, scissors.
So in terms of our connection to the government, so we have joined the mayor's downtown activation team. And so our role in that is essentially expanding the Third Avenue project to cover a larger service area. So as there are all these different efforts going on through the downtown activation team, like our role is engaging the community, connecting people to resources, providing that long-term case management. So we have regular meetings with folks in different government positions and people in the mayor's office. Additionally, we have our policy coordinating group where we do invite council members to attend, and they're able to see like what we're working on, what our challenges are, and provide feedback that like directly impacts the work that we do in the city. And then in terms of our collaboration with larger organizations, like we meet all the time. Us and our organizations connect. We have a bi-weekly check-in meeting for the Third Avenue project specifically. We have a meeting just for housing for the Third Avenue project where I'm regularly just showing up at Tab's office and chatting. And also too, as soon as we find other organizations that really just match like our passion and our love for the work, we're usually the first ones to reach out, or even they would reach out to us. Like Max mentioned, we connected and we met like in the fall and had a really great conversation. When I met Deacon Frank, I was like, "What's your email address? Let's talk, let's connect." So we're always reaching out to people, always expanding our resources, because at the end of the day, to support downtown, it's not going to be one organization or one group. It's a collective effort of all of us working together, all of us providing our own unique skills, assets, and experiences. We also connect with community. I regularly go to downtown community council events. I love to go and hear what the community is experiencing, talk about our work, and just share in the progress, share in the struggle, and work together.
I'm going to start and I'm going to hand it to Deacon Frank, but so we're not funded by the government, but we have, for example, a board member who's a public health nurse. So we're very connected with lots of other organizations. Because we're one of the last organizations that's open, our meal is served at 8 p.m. We have lots of people who work on our night shift who actually are from different organizations. So we have people who work for the City of Seattle, King County, YWCA, Project Reach. We get to work with lots of people, and our staff often has more than one job. So in that way, we're able to coordinate. And we're also part of the Meals Partnership Coalition, so we get to know what's going on with the city, and similar for shelter and housing. I'm going to pass it to Frank.
Yeah, I greatly appreciate the question, John, because it reminds us that we're not in this together ever. Although I think Night Watch has uniquely tried to carve out a space to make sure we're seeing the person who's falling through the cracks of the cracks of the cracks. It's not uncommon when I'm sitting with someone at our meal center at night to get into a deep conversation and just innocently ask something like, who's been a loving person in your life? Who's really helped you? Or even if there's a one time, and repeatedly after pondering, no one comes to mind is the answer. So we're always aware that we're in this fabric of needing each other, and this person maybe sees us for this one moment, and we're going to try to pass them on to who's next. But we're always trying to be sensitive that in that moment, we are the only one who's going to express love to the person in front of us. So it's kind of a little bit of a seesaw at a given time, but thanks for that great question.
I let everybody speak this time without interrupting. Our next question is from Karen Kalish.
Thank you. I'm curious about the data that you're collecting to show that you are having an impact with your work in the community, and who you're working with to collect that data.
So I appreciate the question again. We, given that we're outside of public funding, we are not in the HMIS system of collecting data, which on a positive side has afforded us just the luxury of time to really get to know someone in depth. The folks I know who are in the system say it's great for establishing a directory and ideally helping someone who's more ready and more willing to engage in sharing private information. Back to my conversation with John a second ago, we have found it to be struggling, a challenge to try to exact the most intimate traumatic details of someone's life in a 15-minute time frame. So we are not participating in the HMIS system, but we are collecting and tracking people who utilize our services in the streets. It's a little less formal. It's my name, hey, I recognize you, and whatever name you want to give me. And a success will be, hey, it's you again. Hey, you're the only person to talk to me this week. So that's one type of data. When you're way downstream talking to someone who's never loved, the data is, thanks for saying hi to me. We are getting better. We just started a system at our dispatch center where now we're tracking unique individuals who are utilizing our data. And we're starting to collect a little bit of info like veteran status, where you slept last night, and what other services you need, just so we can have our own little internal system and we can start to trend some of the needs.
Yeah, I'll just add that we do track numbers of people who come in to our dispatch center per night, which is why I was able to say, over close to 60,000 meals. It's actually 57,000 something meals that were served in 1 year. We also know about the seniors who come into housing and the interactions that they have on the street. So we also track the amount of blankets that we give out. So we do track but we are just not part of the HMIS system.
I don't know what HMIS is.
Oh, homeless management information system. It's the by name directory.
All right, thank you for that question. And data is something that we really value within our organization. And kind of what's exciting going forward is because we have changed our service delivery model and we just installed this new training program, we're trying to keep track as much data as possible in order to determine what is important. Is our program is our program a success? So when people are coming to Uplift, we try to get as much information as we can and as much as they're willing to give regarding their situation, demographic. This allows us to, for instance, create individualized employment plans for each of them. But we also know kind of who's coming to Uplift and what struggles they may be having. And then once they're with Uplift, we do our best to keep track of information like what certifications are they getting? Are they enrolled within our BFET program? Are they getting employment? And if they are getting employment elsewhere, how are they doing retaining that employment? But one thing that's also important when it comes to data is just hearing from the participants themselves. So when they enter a program and towards the kind of the end, when they're done with their training program, we have surveys where we ask them about their experience. And that's kind of how we kind of evaluate kind of what from them directly, kind of how we're doing.
We have a data management system called Gelada. And with that particular system, we're out 15 and a half hours a day. And so we're interacting and engaging with the community hundreds and hundreds and hundreds of times a month. And so we track and document every single interaction that we have, every single engagement that we have, either with somebody from the vulnerable population to a business owner, to if we coordinated something with SPD, with the care team, Narcan reversals, like all of it, we've documented. It's extremely detailed. And so with that information, what it allows us to do is the area that we're working in is so transient, right? Like people are coming and going from all over. And so with the thousands of people that we might encounter every year, we can actually see who's passing through versus who's actually living and residing down there and who actually needs help and services. And so with the limited like human resources that we have, we know who it is that we need to be focused on. What's also unique and powerful about Gelada is that a lot of the organizations that we connect with, primarily COLI with transitional housing and intensive case management, and with LEAD and with READ for outreach and case management and legal support and services and a whole host of other things, we're connected in communication, not just with regular meetings, but also through that system. And so those service providers can also see an incredible profile or picture, a snapshot, if you will, of the person that they are engaging with, or the person that we are referring to that particular organization. So in that way, it is not just it helps to support the collaboration that what we're trying to accomplish underneath the Third Avenue Project umbrella. And so it's unlike anything that we've ever seen.
Thank you. We are out of time. And Vicki is going to be making her way back up to the podium. And as she walks up there, I'm going to give you time. This is a very, very rapid fire. I want one singular word, one adjective that empowers and inspires your day to get to work every single day. And you're gonna, I mean, we're throwing the microphone down. So you better come up with it quick. Yeah, one single adjective.
Human resiliency.
Relentless.
Dignity.
Community.
Empowerment.
Hope.
Love.
Love.
So purpose, dignity, action, Third Avenue Project, we deliver care, reach Uplift Northwest and Operation Night Watch. Thank you all for your amazing presentations. You've really created an awareness about your project work, and you can think of these 75 people in the room now as your friends. And also, this fabulous Rotary Club of Seattle is always looking for membership. So if you want to learn more about that, we can talk about it afterward. Okay, as I said earlier, voting will begin tomorrow and it will end at noon on Friday, the 7th. So you want to watch for the ballot to hit your email inbox in the morning. You don't want to miss, right? You've been here, you spent this time. So the ballot is going to have a link to the 3 finalists' applications, to their websites, and also to a video for tonight's event. And then as you're talking to your Rotarian friends that were not here tonight, please tell them about it and make sure that they don't just vote. Make sure that they look at the ballot, they look at the applications, they look at the hard work and the project work that goes into everything that these organizations are doing before they cast their ballot. Okay, so that's it for tonight. We thank you all for coming, your generosity. We couldn't have done this without all of you in the room, so thank you so very much. And I think maybe, is the bar open still or is it closed? All right, well, thank you again. Good night, everybody.
Very well done. That was, you were very good on the podium.